Good afternoon, everybody. Thank you so much for joining us today. My name is Mitch Stripling. I'm the director of the New York City Preparedness and Recovery Institute, which is at Columbia University with our key partner, the CUNY Graduate School of Public Health and Health Policy. We're super excited to see you all today. As you know, we're facing a world with a number of threats, and many climate related threats are coming at us left, right, and center. It seems like faster than ever before. We saw hurricanes hit Asheville, North Carolina last year. We saw fires rip through Altadena and Maui and around Los Angeles. These threats are new in terms of scale and scope, and they require different forms of preparedness. We would argue new kinds of readiness that we haven't contemplated before, that are more community centered, that require more from public health, that really require all of us to step up in new ways to help the communities that we love. So that's why we're so excited to have a conversation this afternoon with some really spectacular New Yorkers. I regret to say at the outset that Jeff Shaman isn't able to join us today, but never fear because we have such an exciting group of panelists for you this afternoon. I'm excited to introduce Mariah Washington to y'all, who's the Director of Community Engagement at the New York City Emergency Management Office. In particular, Mariah pioneered Strengthening Communities, which is a new kind of program that's designed to build capacity and to compensate local networks who are working on neighborhood and hyperlocal emergency plans. That's the kind of spirit that we really need to get the city ready for what's next. I'm excited to introduce you to Adam Sobel, who's a professor at Columbia at both the Lamont Doherty Earth Observatory and at the Engineering School. Adam has been developing predictive models and data sets to assess the risk to our society from tropical cyclones and other extreme weather events, the kinds of innovative forward thinking we need to protect and get ourselves ready for these climate-driven emergencies. Also, I'm excited to see Angel Palermo, who's been on a number of PRI events. We're grateful to have her as a board member and a partner. She founded way back in 1999 the Harlem Community and Academic Partnership, which led to the East Harlem Emergency Preparedness Collaborative, and then the East Harlem COAD, or Community Organizations Active in Disaster, a coalition that she's the project director of, who improves the readiness of East Harlem through better coordination between hyperlocal and neighborhood entities. And finally, leading us through all of it is Julian Watkins. Dr. Watkins is Assistant Commissioner of the Bureau of Health Equity Capacity Building at the New York City Department of Health and Mental Hygiene. He really spearheaded the 4 sessions that we're doing on climate and public health that we're having. I'm grateful for his work in climate in particular. He was a Climate Health Equity Fellow with the Medical Society Consortium on Climate and Health, and also worked through the Robert Wood Johnson Foundation's Culture of Health Leaders program. He's a figure in New York City today who's really bridging the public health and emergency spaces, working at the intersection of community and governmental leaders. So excited to have you on, Julian. I'll just say one word of framing before I hand it over. We do a lot of webinars at PRI. We try to get lots of people for education. This is something different. The idea here is you're going to hear from these experts and you're going to have a chance to talk with them. We're looking for deep discussion and conversation on these issues because we're all trying to figure them out together. The last session, we had some great conversations, some deep questions that we're all still thinking about. And after this, we have 2 more sessions in the coming months that are leading to a call for action to all of us for how to make New York society better. So grateful to have you all on the journey. And Dr. Watkins, I'm handing it over to you.
Thank you so much, Mitch. And welcome to everybody to the webinar. Welcome to our distinguished panelists. As before I hop in, I just do want to acknowledge that last week we celebrated, or I think commemorated, the beginning of the COVID crisis. It's been 5 years. It's really hard to believe that it's been 5 years since the beginning of that crisis. I won't say that, that it's over. We know the impact of COVID-19 on our communities, the continued impact, and we're only just beginning to understand the very tip of the iceberg of the chronic medical condition, series of conditions and phenomenons that we could describe as long COVID. And we're just in the beginning of what this actually means and how it impacts us. And so as we have this conversation about climate change, through the public health lens, we often look at the crisis, and that's what we'll talk about today. We often look at the emergency outbreak, we look at the storm that's come, etc. But public health also, as to the earlier point, is a long game. We have to think big, we have to think long, we have to think about preparedness. And this in the 5-year marker since the beginning of the COVID crisis, really, I think is a great opportunity for us to kind of do both of those things, and to kind of think about how we can prepare. I think in the last 5 years, the conversation has grown around the role of public health. We've seen our strengths. We've also, a lot of our weaknesses have been exposed. But I think the best thing that we can all do as various practitioners of this multidisciplinary field and all of our partners is convene spaces like this and to talk about important issues. And so, yes, often we do not like to talk about the scary times, the emergencies, but that's part of what we do. We do hard things, as we shared in the last talk. So, New York City, when we think about climate emergencies and preparing for these emerging threats and emergency preparedness, we understand that some regions are more susceptible or vulnerable to certain things when we think about the climate. And so the city of New York, in recognizing the changing environment and looking at the changing climate in New York City, took some time. The mayor's office for environmental justice and climate health really looked at and identified with a lot of partners across the city what are our key threats, our key climate threats in New York City. So we've identified 4 key climate threats for New York City. When we think about New York City in the Northeast, we're surrounded by water. Most of us do live on islands. We think about coastal surge flooding. We think about these storms that come, and we'll bring in Adam in a little bit, Dr. Sobel, just to speak about the science behind these changing patterns. But we also have identified extreme rainfall. Folks do notice anecdotally, and from our experience that the subways are flooding. That things that we didn't have to worry about before are happening more routinely with just these super storms. We're also thinking about the kind of more chronic tidal flooding. When you look out to the Rockaways and the coastal towns, you see the erosion of our beautiful beaches and all of the efforts made to restore that and understanding so many homes, so much infrastructure is at risk. Those are the 4, and extreme heat. Let me not forget extreme heat. Extreme heat is something that really stands out for me when I really became aware of. I think that was actually the portal that helped me access and understand how deeply our bodies and our health and our public health are impacted by the weather. When we understand that
Um,
over 300 people in our
I
city.
mean,
Pardon, could you mute yourself?
yeah, how much?
We'll see.
Yeah,
Can you mute them?
11? Okay. Thank you.
Yep,
Uh,
we're on.
5 years later, we're still sorting out all the Zoom stuff. But understanding how in New York City, more than 300 people die a year because of the really hot days, and understanding through our public health surveillance and our understanding of where how people are impacted, we know exactly where this happens. It happens every year, the same neighborhood, same communities, and to work in my official capacity in the health department on programming to meet those needs, to raise awareness, but to also work with older adults who are some of the most vulnerable, to really see what we can do using our public health approach to raise awareness, to build capacity, and prepare for those days. And so we've been thinking a lot about how do we do that. We're using all of those skills, but at the same time, we also understand where we could use some help, where we could tap in our partners, our colleagues. And so as we're having this conversation today, I hope that we can talk from our experience about the work that we're all doing. But I feel before we hop into that public health frame, I would love to open up the conversation and talk to you and talk with you a bit, Adam, and just to hear from you and your perspective about those 4 climate threats that the city has identified. Just your thoughts on some of the trends, what the data is showing, and what it's telling us.
Yeah, so I'll talk about, thanks, Julian. I'll talk about those 4 types of events. So in terms of what we understand about the risks and how they're evolving because of the changing climate. So heat waves are probably the simplest one. because the planet's getting warmer just about everywhere, including New York City. And so if we define a heat wave as just a period where the temperature gets hotter than something, you know, whatever it is, 90 degrees, 90, whatever threshold you want to put for some period of time, then that is happening overall on the planet. And New York is not an exception. We expect that to be happening more often and with greater intensity. And it's almost as simple as it sounds. A hotter planet is a planet with more heat waves and more severe ones. There are factors that make it variable from place to place, and it's not saying that it's going to happen every year. It depends on the particular weather situation, but the risk is going up for extreme heat. There's no question about it. Coastal flooding. So the big event in the memory of those of us who are not, who are adults is Hurricane Sandy, which we experienced. So we don't need to, speculate about what it looks like. Although we can have it with winter storms too, but a hurricane is probably the biggest risk, as Sandy was, although technically not a hurricane at landfall, but it more or less was. And the science on the hurricane part is still pretty uncertain. I mean, we know that hurricanes are getting stronger. Whether one like Sandy is more likely to happen depends also on how many hurricanes we have, and the science on that and how that's changing is much fuzzier. But I will say that in the North Atlantic Basin in particular, where we live and where our hurricanes come from, the trends have been up for the last 30 or 40 years. And there's still debate about why that is. It's probably not all global warming, but the factors are such that I think the chance we return to a low period like we had in the 70s and 80s are lower than they would have been in the past. In other words, I do think the risk is elevated. And one thing that elevates the risk definitely is sea level rise, which just means that, I mean, there's no question the sea level's rising. The only question is, how fast it's going to rise in the future, whether it'll accelerate compared to where it's been, the sort of few millimeters per year that we've seen. But it's definitely going up. And that just means that any storm that causes a coastal storm surge is happening on top of an already higher background sea level. So the risk of a surge event is going up because of that. So, Sandy was probably not quite the worst case scenario in terms of the present climate, but maybe getting close to it in terms of the type of storms that we're likely to have here. But in a rising sea level, we could experience a worse situation. The extreme rainfall is maybe the most tricky one in some ways. It's because there's more water vapor in the atmosphere, and so we expect more rain to fall in heavy events, and we're definitely observing that in the Northeast United States even more than elsewhere over the last decades, as you can see in the national climate assessments of the last couple of them. So we expect more events like Ida. That was the sort of maybe the most extreme one of the last few years, and in some ways shocking compared to past experience, because what we learned from that is that what matters is not just the total amount of rain that falls, but how quickly it falls. So in Ida, we got, depending where you were in the city, 6 to 8 inches in just a couple of hours. And that can really overwhelm the storm drains and the sewer system and cause flooding, even in places that aren't that low lying. And so, the subways flood, sure, but we also saw people drowning in cars and in basement apartments. And the tricky thing about that is that those events are maybe harder to forecast than hurricanes. I mean, Ida had been a hurricane, but the specific rain, it's harder to forecast than storm surge or heat. The forecasts have gotten much better, and the remnant of Ida that caused that flooding, as well as there was another event the year after, I believe, if memory serves, that didn't have a name. But those events, there is some skill in forecasting them, but I think there's still a challenge in forecasting what really matters, which is how much rain falls and how quickly it falls, because that's what really controls that sort of flash flooding hazard. And for the forecasters, not only to see that in their models, but to be able to communicate it effectively enough with the uncertainty. Everybody's always afraid of false alarms and crying wolf. So that's, I think, a tricky thing. But we're definitely at risk for more of those events. And finally, chronic tidal flooding is not an extreme event. It's a sort of chronic thing, as the name suggests. And that, is just inexorably getting more serious due to sea level rise. So it's because it's very, very directly related to that. The tides themselves aren't substantially changing, I don't think, but it's the background sea level that makes them worse. And so in the lowest, we know where is vulnerable to this. It's the lowest lying neighborhoods around Jamaica Bay and, the Rockaways and places like this. So that's just something that that we're going to have to deal with more and more as time goes on. So that's sort of a quick summary. I'm happy to talk any more about any of those things in detail. I can get into all the nerdy weeds if people want, but why don't we just leave it there and let our colleagues talk about the public health issues.
Thanks, Adam. That's a great summary. And yeah, I think that the surge flooding is something, also understanding the vulnerability of folks living in basement apartments and understanding some of these kind of social determinants, and folks don't feel empowered or safe to get the help that they need, to even, know where they can go to prepare for these sorts of events, or to know that this was actually a possibility, again, in the richest city in the world. So, with that framing and this understanding of where the trends are going, I wanted to transition a little bit and bring Mariah into the conversation. My city worker friend, we've been working together for a number of years on emergency response work. We'd love for you to share some of your experience, if you have any case studies or just real world examples of preparedness and response in your role in New York City emergency management, but kind of how you see and understand the city's process of preparing for these sorts of events.
Thank you so much, Dr. Watkins. It's truly a pleasure to be here this afternoon. On our end, for the city of New York, there has been a lot of alert of, oh my goodness, it's flooding in places we never thought would happen. And there have been several different reports. And so I think sometimes the public thinks, oh, it doesn't mean anything if a public advocate writes a report up or City Hall writes a report up. And it's actually the opposite. Like, the reports actually allow money to be delegated to initiatives that are targeting programming and processes to address and close out these gaps. And so, rewinding to when COVID first body slammed us in so many different ways, on the emergency management side of things, something you all should know is when we get a declaration of emergency at the state level or even the federal level, it unlocks a chest of money that overfloweth. And when money overfloweth, there allows flexibility for innovation to take place. And so during COVID, we were allowed to receive some COVID recovery funding and launch a program called Strengthen Communities. This is a really great case study in the sense of what does it look and feel like when you tap hyper-local community coalitions or networks that have multiple member organizations attached to them. When you tap them on the shoulder, we say, you're already an amazing resource. What does it look like if we're able to compensate you through this journey of creating a hyper-local emergency plan? We don't want you to be first responders. And they'll say, Miss Mariah, we are first responders. And I say, okay, and we will honor that. We don't want you to put yourself in harm's way and take the place of what the city will do in terms of fire department, police department, public safety. However, you are already touch moving and inspiring a population. You're movers and shakers. What does it look and feel like to equip them with trainings and people resources to be able to amplify messaging, to be able to manage donations and volunteers when the next emergency happens? Because that's a major emergency. After the emergency is when donations start piling in, and then we have to contact the Department of Sanitation to discard them because it's a health hazard, right? And so with Strengthen Communities, it is leveraging relationships that exist in hyperlocal ways, equipping them with some tools. We have some groups who are at the high level of knowing how to prepare and respond to emergencies. And then we have some groups who that's not their primary focal point. Their primary focal point is education, youth development, or it might be immigration rights and providing general social services to their populations. And so we are targeting those groups that we know have a reach in a vulnerable community, and they're able to establish preparedness. They're able to enhance the culture of preparedness through workshopping, through socializing their emergency plans, and through creating an expectation. Like, you can expect, you're going to hear from our coalition when heat is impacting us. We're going to give you heat preparedness reminders. In so many ways, having the money to compensate our partners is essential. When we started getting a couple of the heavy storms pre-Ida, we were like, wait a minute, what does it look like to activate these coalitions? That means compensate them to amplify messaging in the places that our general messaging for Notify NYC is not going to reach them. So we have to opt in. We can't mandate messaging to go out. It's not an Amber Alert. It's an optional tool. And so when we have our partners do amplification, we can compensate them. And it's not a lot of money we're talking. It's small amounts, like $4,400 for a day and a half of amplifying messaging to the culturally appropriate and language access needs of your community. Give us back the data after you complete. That's phone banking, that's text messaging, email, social media. So with strengthened communities, it's that building that preparedness lens, having that response, but also leveraging the connections that they have to get those hard to reach possibilities of messaging of, hey, the storm is coming, here's what you need to do. When I think about the public health lens, I think about the two different groups that I've done a lot of speaking with. One is the Medical Society Consortium on Climate and Health, and that's through George Mason University. And Dr. Watkins was a fellow there. And another one is University of Colorado. They have the diploma in climate medicine. And I call out these two groups because they're meeting with public health professionals and practitioners of health who are already doing the work in their fields. And their curiosity is, well, we do know that there is climate change. What does that mean in terms of the patients that we're seeing? Oh, there's an uprise and an uptick in these type of cases, and it's based on the vulnerability. Can we do some early prevention or outreach? What does it look like to engage with communities? And so I always come in with the lens of community partners are the assets. They are not a burden. And the moment that we go with that proactively and not treat community as an afterthought, collectively as government, we will be in a lot better, strong, stable place. And so there is a lot of thumb wrestling that happens, a lot of arm wrestling that happens. But in so many ways, how can we ensure that there's preparedness being trickled out to the community groups that want to engage? And how can we get money into their pockets? It's not enough to create a salary, but it's something to say, we honor you. Here's what we are able to provide at this time to honor the people that are doing the work on your side. Because the reality is some of these groups are made up volunteers, like, or you have an executive director that's doing 18 things, and then they have 3 super volunteers that are retired who are everywhere. They're in every crevice of New York City when I pop up, and it's like, oh, you're here again. And so having something to just provide a supplemental appreciation and honor, because we can dish out money for a new t-shirt, we could dish out money for some food, but let's be strategic in getting money into the pockets of the community. And those are the very folks who are doing the preparedness work and the response work. And we're creating more of an interdependence versus a dependence. And I think there is a strong imbalance that's been created throughout our nation and definitely in New York City, and how the public depends on New York City. And we're outnumbered. We are outnumbered in so many ways. And so we need the community and we want the community. In so many ways, I think of that. I think of, there are a lot of emergency managers and emergency management organizations that have someone targeted just for community because they're stretched so thin. And so it could be that it's city planners that are able to open up their budget and leverage funding to initiative of preparing and getting some basic preparedness tools for then these coalitions to amplify that preparedness on the individual level. Preparedness doesn't stop the emergency, but it sure does make our bounce back even stronger. There is one case, Dr. Watkins. His name is Dr. Armand Henderson. He works for in Dade County in the street response organization. And I think of him because he and I were on a panel together a couple of years ago, and they do some amazing street outreach, meeting the vulnerable population where they are. And so during COVID, you know, how many of us were able to actually go to the street, to where houseless folks were, or where folks who were addicts, and actually provide them with the vaccinations on all these different elements. So when it comes to the extreme heat, they're able to do that. They have a lens of disaster response as well of, oh, there was a major storm. We got to make sure that the folks who are diabetic have their medicines to keep them going. So he is a good best practice. I dropped the link in there. I definitely encourage you to kind of take a peek at their organization and what they do, because it's not a matter of can it be done? It's a matter of, are we able to create the capacity for community partners to rise and shine in the ways that they're able to?
Well, amen. I agree on so many things, and I think we can't take goodwill for granted, the goodwill of the community. We really have to think about how much we really need community at the table. And I'm always reminded of that organizing principle, nothing about us without us, and understand that if we want any buy-in from our neighbors as we're trying to prepare for and respond to things, we're going to make sure that we have space for folks to be there to contribute in a meaningful way and to really be, as you said, like we are outnumbered. Like we can't do it by ourselves. And it takes a little bit of a shift from kind of how we're trained to kind of like, we're the government, we got this, to like, we need you guys, we depend on you, but we have some skills and training that we can coordinate. Like we have our place in it, but it doesn't just all fall on us. And speaking of, needing community partners, I'm so happy that our third panelist, Angel, is on the call. And Angel, we'd just love for you to just, share a little bit about your work. And also if you could speak about how this changing climate, how we have to really think about equity in the communities, that are the most impacted, disproportionately impacted and vulnerable. But how do you, develop and think about tailored strategies for these community-based interventions that are not just, top down, fly in from the helicopter?
Yeah. Well, first of all, thank you for the opportunity to be a part of this important conversation. Just want to give a big sort of virtual hug to Ms. Mariah, who has been an outstanding partner with the East Harlem COAD. And to amplify a lot of what she said, the fact that there has been a commitment to put financial resources on the table to compensate, community members and community organizations for their time and their wisdom and effort is critically important, and I would say one of many critical success factors for the East Harlem COAD. The East Harlem COAD stands for Community Organizations Active in Disasters. We started in 2015, and it really was an outgrowth of an early awareness in East Harlem about the ways in which weather-related hazards were going to impact East Harlem. After Hurricane Katrina, we started to sort of pay attention to, what was really happening in neighborhoods that looked like us, and, located in the northeast corner of Manhattan, because I see some folks from Ohio on the call. So just want to let you know that New York City is a city of neighborhoods. We are at 2.4 square miles in the northeastern corner of island of Manhattan. And back in 2007, when the Bloomberg administration put out a report of like, this is what the damage impact zones would look like with hurricane and coastal flooding, we saw East Harlem, in the red zone. And we were like, well, what are we going to do about that? We just look at Hurricane Katrina, what it did to the lower Ninth Ward. And what history can tell us is that, communities like East Harlem, low income, low resource, historically marginalized, and you can give all the descriptors, are historically geospatially vulnerable. And that is true for neighborhoods in New York City, like in the Lower East Side, the Far Rockaways, and of course, East Harlem. And if you look at all those neighborhoods, they were in the red zone. We were going to be underwater. And we started to explore, like, well, how are we ready? Like, has anyone figured out if we're ready? And I want to distinguish ready versus resilience. And we were very intentional about focusing on readiness. And I say that because we knew we're already resilient, right? If you think about resilience, referring to like long-term capacity of a community to withstand, adapt to, recover from crises, we knew how to do that really well in East Harlem because of the historical impact of systemic racism and oppression in communities like East Harlem. So that was already a given. It was the fact that we had a low level of readiness, meaning we didn't really have the ability to prepare and respond effectively to emergencies, which means that, God forbid, there was a massive hurricane coastal flooding in East Harlem, we would probably get one of the first neighborhoods in New York City to get hit and the last to reconstruct. And history has shown that is true for many communities that are both historically communities of marginalized, backgrounds or color, low resource, and geospatially vulnerable. So you have this compounded vulnerability that is profoundly difficult and challenging to fully reconstruct when there is no readiness infrastructure in place. So the COAD came about, and shout out to Long Island, to the Staten Island COAD and LES Readiness. There were two models that we were like, oh, that makes a lot of sense. Let's create a neighborhood-based hyperlocal network of community organizations, because one of the other things we learned from Hurricane Katrina is that they missed the boat of partnering with non-traditional partners in emergency management. They didn't think about the community-based organizations, the grassroots organizations, the faith-based organizations, the small businesses that would be actually the most important partners in emergency management and response. And so we were intentional with the COAD. The design of the COAD is that literally we took this COAD model that we learned about that happens in Tornado Valley, the middle of the country. So what if we zoomed in and made it to, neighborhood-based? And I have to shout out, NICEN was involved from the beginning, but they were really kind of like, I don't think they really could see a neighborhood-based model. They wanted more of an expanded kind of regional, like Upper Manhattan. And we said, nope, we're staying local, we're staying local. And I like to think that we helped set the blueprint of the strengthening communities and work and model, and what we are now as a community emergency network. It has been quite a road to really, building out the capacity of East Harlem to be ready, because what we had to do and what we focused on is really a mindset shift. Naturally, we kind of are someday, one day kind of people, just thinking about, oh, someday, one day, disasters happen. But we needed to shift from a someday, one day to an all day, every day. And especially as New Yorkers, we are always exposed to daily hazards of living, but we're also desensitized to it in so many ways. Unintentionally, we're desensitized. And so we realized we needed to sort of focus on a mental model shift, and really begin to start to use this focus on emergency preparedness as a way of everyday living, like really being ready. I think COVID clearly catalyzed this mindset to become much more present and in the forefront of East Harlem residents. And we realized that we had to continue this hyperlocal planning focus, really deep into our community-based organizational members and build out the organizational capacity for them to be ready to respond to an emergency. We do that in a variety of different ways, with skill building workshops, knowledge enhancement, opportunities, and of course, practice. And that's a space that is always challenging for communities, which is to practice, especially when you have these particular agencies who are not traditional partners in emergency management. Trying to create the bandwidth to practice is actually a very significant challenge that we have, because as much as they want to, they're also serving a very vulnerable community and a high need community. So when you mix in, all the other factors like environmental, social, economic factors that intersect, that's what they're trying to address for, various populations in East Harlem. And then you add in rising temperatures and extreme weather events and the East River flooding First Avenue and the eastern half of East Harlem, and poor quality, air quality because the housing is disrepair. Where, the main avenue going up to the bridges, so all the trucks are coming through East Harlem. You add all that on, that's a lot. And when you really unpack it, you really begin to see that you have to focus on readiness, but every day, all day, in a way to mitigate, the exacerbation of health disparities. So I think in the COAD, we have been working on, again, building organizational capacity of non-traditional partners in emergency management, targeted education and outreach, tailoring and customizing the content and the knowledge for specific communities, and making sure it's culturally tailored and relevant, like, oh, I can see why I need to have a flashlight on my keychain. To, resiliency through social networks, really beginning to think about how can the agencies and the networks really build and scaffold onto each other in ways that allows us to be effective in the event we have to deploy and activate. I think the other piece, which is really important, and is that our advocacy and policy alignment. We believe in tracking the rashes and the pain points that play out when there is an emergency response or when there is something happening that's impacting the health of East Harlem residents. When COVID hit, we tracked all the pain points and rashes that were playing out from, for example, not being able to get masks in East Harlem. And we were one of the highest, impacted zip codes very early and within a month of the pandemic, and we were begging for masks in East Harlem. Okay, so we tracked that and made it very clear that we were going to sound the alarm and give voice to these pain points and rashes to our elected officials and to our partners in Department of Health and in NICEM. And I have to give them a shout out because thankfully and gratefully, we have partners in NICEM and Department of Health who are so like-minded that they have been an important partner in helping to get our voice be heard. Both as its individual entity and as a collective of community emergency network. So a big thank you to them. And that is another important piece of this pie, if you will, of a collective response, a citywide response that supports a hyper-local response. You know, in other settings, other counties, that is such a critical piece, is fortifying that relationship at the hyper-local level so that we can plug into a citywide response if necessary. I think that the last point I want to make is, and this is to our beloved Ms. Carol Johnson, who's, I believe, on the call, member of the COAD leadership team. You know, the bottom line is that if you stay ready, you don't have to get ready. And we want that to be available and known and as a practice at the individual level, meaning the resident level, to the organizational level, to the community-wide level. So I'll stop there and answer any questions.
Thank you. You know what? You know, that was one of my quotes from last time. Stay ready so you don't gotta get ready. Maybe that's the theme of the series. Like, how do we stay ready? And thanks again for sharing that experience and encouraging folks to start thinking about some questions. So you can have some pointed questions for the panelists. But before we kind of transition to as a question start to build up, you know, what you touched on, Angel, you know, you kind of set me up for this next thing that we're thinking about for this discussion about the systems that we build and the approaches that we build. How do we assess them? How do they add up? And what do we want to do to change them? Recently, the city published our report on how we did for COVID-19. It's about 100 pages. It was recently published. We can definitely share that in the chat as well. To look back, we made some critical assessments, identified some of the pain points that we had, and that was published. This was many years of work, many rounds of review, but also thinking about the systems approach that we took to address COVID. You know, I myself was brought into the COVID work, coming from sexual health clinics, brought into contact tracing, then kind of brought up into setting up the vaccine program, and that work kind of evolved. But one of the things that I'm most proud of was the work that we did with the Public Health Corps, the New York City Public Health Corps. You know, all of these resources were made available to address COVID. We need to set up an entire system and a whole approach to get those resources out to the communities and really think about it from the hyper local level, neighborhood by neighborhood, and to see how we were able to use that money, get those resources out there. But I think one of the other resources that we were able to really appreciate and appreciate more fully was the human resources, the community resources. We met so many partners, so many activists, so many people coming from different walks of life. You know, I met all the PRI folks, you know, through all of that experience. And so as we're thinking about the post-COVID emergency response, and we're thinking about, you know, the next 5 years, that's what we're thinking. And I think we're all the more wiser thinking about climate change as a part of this. And so as the city last year released our Healthy NYC initiative to address the drivers of our low life expectancy across the city, climate was named specifically. And thinking about how we can use all the resources to address that one crisis, COVID, how we can pivot that and integrate, you know, climate and these other real public health threats into this planning. How do we not let all those relationships and connections fall aside? That's why this systems-based approach, I think, is so critical. And I think it's also honestly critical for us to kind of take a little bit of that steam off. These problems are so big, right? And in public health, because we address these big systematic problems, really understanding, where do I plug in? You know, and all four of us on the panel come from very different experiences, right? But we're here today and we found our niche within the larger environment of folks trying to raise awareness around climate change, using the skills and talents that we have to address it. And I think that's what it takes, us really just finding where you fit in the the best, how your talents can be used to move these things forward, committing to that, and continuing to kind of come back and reiterate. We always take that time to kind of think think how we can do better and how we can prepare. We talk about it from like a blue skies are every day and gray skies. It does rain some days. What kind of umbrellas and systems do we have when it does rain? Wanted to see that there's a few questions in the chat. I can start with Erica Benjamin. From the community perspective, what is the mental model shift you are targeting? Is it awareness by the community?
Yeah, so I was just starting to type, so I'm glad I could say it. I think there were a couple, as I was saying in my comments. One is we quickly realized that folks are really sort of like this one day, someday, like, oh, I'll just kind of get ready when it's like happening tomorrow. There's just such a short runway between getting ready and having an awareness and like the event happening. And we were like, you guys, like let's take it back to everyday living. You are on the subway, you are on the train, you are, we are around daily hazards of living all the time. How ready are you for that? That's where we started. And then it was like, oh, actually, I'm so desensitized to it. I don't even really have an awareness. And so we use that as the entry point to open up about, well, now think about these things that are happening, and they're happening more often. So how can we start to begin is fortifying that readiness mindset? And that led to, so if you stay ready, you don't have to get ready. And we talk about the impact when you're not ready. So what happens when you're not ready, right? What does that look like? And then that's like the dooms, it's like the probable almost certain future of not being ready is all of these outcomes that are adverse and will not work for you or your family or your loved ones. So that's the response to that.
And on our end, my team, we lead community preparedness. And so we know it starts at the individual preparedness level. And what that looks and feels like is when we start talking to organizations and we're like, okay, like prioritize your services, which ones are going to be critical for you to continue to keep going after filling the blank emergency happens. And oftentimes partners are like, wait a minute. And I'm like, what's the look on your face? What's going on? They're like, what about me, my household and I? So we make sure that we cover that individual preparedness. Our programming is called Ready New York. So we take care of that. Once community leaders of organizations and houses of worship know that their household is taken care of, then they're able to shift into the population that they've been serving for decades. How are you going to keep these services going? We have folks who are houses of worship, food pantry in East Bronx. In December, they were serving 350 people. Last week, they're serving 650 people. That number is going to continue to go up. So as you're serving those folks, hey, Miss Mariah, can you come in and do some preparedness as they sit and wait for 40 minutes? Can you do that 30-minute segment? Because we keep saying it's not if, but it's when the next emergency happens. It could be infrastructural, a main water break. It could be that there is a cloud burst that happens and all of a sudden people are curiously walking in 3 feet of yucky contaminated water to get to their job, right? So it starts with acknowledging, but it's that individual level, your household level, and then think about the populations you're serving as a community organization, as a house of worship. Like I often say, like growing up, I went to churches, we never did a fire drill. And we were big churches. What does it look and feel like to do the very things that we see happening in schools, doing that in the organizational settings and doing that in the house of worship settings as well?
I just want to add, we did the research in East Harlem that showed that organizational leaders, if they cared about their own individual level preparedness, they were more likely to foster a culture of preparedness at the organizational level, within the organization that they were a senior leader of. So that's the starting point.
Thanks for that. So true, so true. We'll hop to the next question. We're gonna skip around in the chat. There's a question for Adam. How are predictive models communicated to the city organization and used for emergency management, forward thinking, mitigation, and preparation?
I suspect that Mariah might be the best one to answer that since she's in emergency management. I mean, I can talk about where weather forecasts come from. They come from the National Weather Service and how they're made. So if we're talking about prediction on the timescale of the events themselves, I believe that's, the main source of the information. I have, a little bit of knowledge of OEM is it still called OEM? I don't know. They do these hazard mitigation plans, and I've been involved in reviewing some of them, but I think Mariah is probably closer to that one than I am.
Thank you for that. For us, for New York City, we have a plan for any type of emergency you could think of in terms of weather related. We have a team that also focuses on the mitigation component. The mitigation component that they often focus on is on the infrastructural level. And so what we are mindful of is, as community engagement team, and as we do the public education, how are we directing them accordingly? So there is actually a mitigation risk map assessment tool that I will find the link in and drop in. But we point public to that direction as well. Like, it's good to see what historically impacts have happened in your community, to know in what ways can you in advance mitigate, and or maybe start to do some research to identify ways to mitigate. So as New York City Emergency Management, we cover these, but we're not able to go in depth with them, with the community, in the ways that my heart desires, right? In terms of our capacity, in terms of how many New Yorkers we have out there.
Thanks for that. I think what I'll say from the DOH perspective, we have a division of environmental health, and we work with some of these modelers, some of these client scientists, and there are available resources. It's not just looking at, flood zones. We're also looking at this concept of the heat vulnerability index. There's available maps of the city where you can see where the hot zones are localized across the city. So that's one example of ways that we can look at that, that we can work with the projections. I think another thing I'll speak about is think of like air quality, and just monitoring and working with all of the various instruments that are around the city to test air quality, and how a couple of years ago we saw our vulnerability to air quality events that even are happening thousands of miles away. But the health department is able to work with I believe NOAA and other entities that are monitoring the weather and air quality, and get that vital health information and connect it. So it's really a lot of connecting and interpreting a lot of the data that comes in. And often, it's a collaboration between city and government employees with internal experience, but also external expertise, working with the meteorologist to help interpret all of the data and how it makes sense for public health. I have a question for Angel. I think maybe Mariah, I could as well speak to it. Just there was a question about the types of resources you utilize for language access.
Yeah, obviously we tap into, I think, some common resources, such as interpreters. We have interpreters that we work with locally who work for other organizations. So we actually tap into our member organizations to be the ones who either co-create, co-produce, co-write the communications, or they deliver the communication however they see fit to those communities. They also, again, when we hold events, we try to make sure that we are clear about who's coming and what language needs are needed. We are just beginning also to get into developing our capacity to do ASL as well, in addition to, verbal, I guess, languages other than English. And also recognizing the intersection of multiple access needs with, not just language access, but being, differently abled, and also being able to engage in these events and activities in a way that works for them as well. When we do present and make presentations, we try to, we create our own guidelines for, being able to have particularly make it accessible for all. And it starts with where we hold our events and how the way we deliver our content and, produce materials. So above and beyond language, we try to take into consideration holistic access.
On the city government side, we have we create contracts with several different vendors to do in-person interpretation. And also we have vendors to do translations. We have a vendor for American Sign Language as well. We, in New York City, we're required to provide language access for our 13 languages of New York City. And so we make sure that we cover that. However, if there is an emergency and there is a service center that's popped up as a response, if we discover that there is a language like Mendigo that is impacted, we go to our vendor and we say, we need someone who speaks Mendigo to come to this location in the West Bronx at this time, and then we create it. What we have noticed is that there are a lot of cities, counties, and states who do not proactively establish these contracts with language access vendors. It's a great proactive tool in practice. It does cost money. However, you know, we are doing all this work for the people that we serve, and that is the community. And so we do prioritize that. We make sure that we also have language access. We have all of the documents of individual preparedness are in the New York City 13 languages. So that can be from Yiddish to Haitian Creole to French to Spanish to English to Chinese. The list goes on. So for us, we definitely prioritize it in that way. We do also use a couple of different tools where we're able to use a iPad and talk through the screen. It's not favored amongst the populations that are in need of it. But when we are in a jam, that's the best that we can do. Then we do have that live interpretation via the iPad or via a phone. So that is the approach that we use as New York City government.
Thanks. Thanks for answering that so thoroughly. I don't really have anything to add to that. We have a comment in the chat on recovery. George shared that in Harlem, it has been some of the senior centers or older adult centers who have allowed access to clients for vaccinations as indicated, also working with local food banks. Yes, connecting with those local points of access, non-traditional. We have a couple anonymous questions in the chat I think that I can take. How are these threats impacting pregnant people, and any strategies to share? So we know that when that people who are birthing people, pregnant people, we know that there are vulnerabilities. Being pregnant really can change the dynamics of your of the liquids of your blood, of your breathing, etc., and can put folks at risk and be more vulnerable to high heat. Also, we know that there's limited vulnerability. So these are things that folks should be thinking about. I've also seen some research or some conversation about the impact of really high temperatures on milk production. That's something that folks can consider. I think the most important thing that we can do for pregnant people, but also other vulnerable populations, right now we are in an education moment, raising awareness, letting people know that right now you may be a bit more vulnerable to certain things. Just an awareness and normalizing these sorts of conversations, really supporting their providers, but also areas of people, community members, to have an awareness that some folks are more vulnerable, and to kind of prepare is I think is the biggest recommendation that I have. In terms of assistance, the next question, what assistance can be given for preparedness expenses? I'll let you kind of answer that, Mariah, but what I would say is a lot of the preparedness expenses, there are resources and things available. It's just for very specific things, very specific preparedness activities. You can get resources through there's certain city programs, certain things that are available. There are also other resources, community groups that may have resources really about specific things. I'm not aware of like individual resources that or individual programs that can for like general preparedness activities. It feels like we're a bit early in this kind of more community focused actual preparedness work, but maybe I'm mistaken. Do you have any other comments, panel, on that question about expenses?
Yeah, we have a lot of resourceful folks. We know how to do preparedness using no money, but we've also learned that when we do spend a little bit of money strategically, it does help. I'll let I'll let you share your best practices, but like for example, last year for heat, we did cooling towels. So we in our outreach and campaign for outdoor workers, that was a population that we're like, we got to figure out outdoor workers in terms of construction, in terms of food pantries, in terms of the urban farms. How can we get them to stay hydrated? So we purchased cooling kits that have a little electrolyte packet, a little cooling towel, a little sealed packet of water. Do you all need to buy that? No. But the cooling towels were our best bang for the buck because they were small, you're able to pass out. And it's just a reminder of like, hey, keep building it. If you are a community group, I would say in New York City or anywhere, talk to your elected officials. They have a lot of different budget lines that have flexibility. And for them, it might be like, I didn't even give that thought. Most of the time, folks like to go for the big, we got to buy a go bag. And it's like, no, like you need to customize your own approach of what it means to be prepared. A small little first aid kit, yes. A flashlight, yes. An AM, FM radio, yes. But we don't need to go on to the famous website that starts with the A and ends with the N and spend hundreds of dollars creating our go bag, right? And so it's really about starting at a very basic. If you want to focus on extreme heat, maybe it's like, let me see how much cooling towels are. That's something that can cool people down literally. Or you might work with a population of outdoor sports and young people. Electrolytes, forget the sodas and all the extra sugar. We need to pump electrolytes in to the adult, the systems of young people and even adults. We have old folks in New York City that like to sit in front of the fans with no air conditioning and say, we've been doing this for 30 years. And they'll look at me and say, and we're going to keep doing it. And all I'm saying is I've been here for 14 years and I melt like an M&M in a pocket when I don't have air. Like it took me 5 years ago to finally get air conditioned because I was like, I can't do it. And I'm not practicing what I'm preaching. Like I'm melting, I'm losing electrolytes. So it depends on what type of focal point you want. You don't need to buy it all though.
I'll just add, we got creative with the funds that we had as a COAD. We recently certified 10 small businesses in East Harlem in emergency preparedness and readiness. And we got them at the table because we offered them a stipend to participate. And we had a very high, we were making sure it was an interactive learning opportunity, made it very relevant to being a small business owner. We had small business owners who were part of the COAD, like really reinforce the content and the knowledge. And, they left feeling like, okay, I need to use this stipend to buy a sump pump because my small business is in the lower ground and I actually have to like think about flooding, right? I need to actually buy these kinds of batteries and all the items that, Mariah mentioned. So it wasn't like we wanted to say, we're going to go, this is what you can buy. It was like, what do you need if we put money in your pocket? And I think that's another strategy that often gets overlooked and doesn't even seem as a trustworthy strategy because it's like, oh, they're just going to take the money and run. They might take the money and run, but they're small businesses. They have content and knowledge, and we have a relationship with them. So that's the beginning of fortifying, right, this community building and the glue more than anything, so that when we have to activate, we know we can call up these 10 businesses and have a conversation in a way that's not like, oh, I don't know what you're talking about.
Thank you. We have a few more questions in the chat. I see one question. I think at least the first part of it is definitely for you, Adam. It comes from Anonymous. What does extreme heat look like in New York City this summer, 5 summers from now?
Right. This summer or 5 summer, I think I feel like I should give a short explanation here of predictability. So we can't predict specific heat waves for this summer. It's too soon. Weather forecasts are no good for individual days more than a week or at the most 2 weeks ahead of time. There are seasonal forecasts. And I'm embarrassed to say that I haven't looked carefully at the seasonal forecast for this summer, but 3, 4, 5 months ahead of time, the amount of skill is very little, especially in our region. So I think really this question, the most confident thing we can say here is about the long-term trend, which is we're getting hotter. So, I mean, the trend is still relatively gradual in the sense that, I mean, it's super fast and scary from the point of view of human history compared to geologic time. I mean, these changes are not to be taken lightly, but 5 years is not radically different from today, but the whole climatology now is warmer than it was, when I was young. I might be the oldest person on this call. So, I think it's just a question of understanding the risk, and the risk is, the forecasts become relevant when we're getting close to the event. But up until that, we're understanding the risk. And both now and a little more so 5 years from now, we're seeing hotter conditions and a higher risk of extreme heat events. Now, going further into the future, obviously the problem just gets worse. 10, 20, 40, 2100, like the IPCC forecasts talk about. Yeah, I mean, there's also, we could talk about humidity. Humidity generally in our region increases along with temperature, so that amplifies the effects. So a humid heat wave, for the same temperature, if you have high humidity, the effect on humans is worse. Your sweat doesn't evaporate easily, and more easily prone to overheating. We measure it by the wet bulb temperature, which you might have seen in some news stories. There's been a lot of research on that. And under dry conditions, of course, now we have to think about wildfire risk, which wasn't historically a thing in our region so much, but now it is. Not only in the heat of summer, as we had recently, fires in winter in Prospect Park.
Yeah.
And we've had them we can get smoke from fires in Canada, as we've had in recent years, or from anywhere else, that's upwind of us. So, I mean, it's hard to be really precise about these things, but the risks are increasing. There's no question about it.
And the second part of that question I can speak to. I'm sharing in the chat a link to the Plan NYC plan that was released early, I think last year, so early last year, really outlining the second part of that question is like, how is New York City comparing to other places and what are we actually doing to cope? There is this bigger systemic approach to this, and Plan NYC is this big effort. And I encourage folks to kind of look through some of these citywide projects, et cetera, that are released. They kind of outline some of the accomplishments from Plan NYC, and it's really this really broad approach for these really key infrastructure investments, changes from planting to extending, more resilient waterfronts to training more folks for green jobs, painting roofs white to minimize like trapped, indoor heat. So there's a lot of things that are happening. I don't know if I could really speak to how we compare to other places. We have our unique, specific needs as the largest urban center in the United States, with many people, the most diverse linguistically, culturally, ethnically city in the world. We have a lot going on. Really old city with a lot of old infrastructure, but at the same time, the work is happening, and these conversations are a part, really help drive that, and convening all of the various folks, all the stakeholders. All right. We have a few more questions. We're reached the hour mark. We usually can extend a little bit past the hour. We have some time, so we can answer a few more questions. And Mitch or any of the PR team, if you have any questions for us, feel free to hop on as well. There was a question from David Pratt. I don't know, Mariah, if you could speak to this. I can't really speak too much to it, just in terms of preparedness and response here in New York City. We've experienced what happens when workers, all the different types, are not provided with the resources to conduct response cleanup and recovery safely. The tens of thousands in the World Trade Center program can attest to the many preventable health issues that can result from unsafe response and cleanup activity. To what degree are we better prepared today than during World Trade Center and Sandy? I think my first response is, the World Trade Center was this, very unique thing that happened urgently that New York City could not kind of predict and respond to. I think that we're much better in an understanding of the risks of some of the ambient air pollutants that were released in the air following that attack and what the long-term effects are. And unfortunately, sometimes that's how it, that's what has happened. But we've learned a lot as a result of the World Trade Center and following folks. I would say we started a cohort studying folks for long COVID, for example. We're going to be following people with long COVID for the next 10 years. So that's like one thing that we got from World Trade Center. I think preparing for other kind of climate related disasters, I think depending on the nature of the disaster and the nature of the cleanup, there are OSHA regulations. There are regulations for safe cleanup that I think have been improved over the last 20 plus years, which I think will strengthen responses and make them more healthy for folks. But there's always opportunity for improvement. And Maria, let me know if you have anything else to add to that.
Yeah, the other element that I'll add is that there's a level of interagency collaborations that happen at a higher level now than before. And so I mentioned before, like sometimes we see a report after an emergency and it's like, oh yeah, whatever. Why did it take so long? Though why does it matter and why does it take so long is because that truly does designate what then budget is sometimes for the next administration for the mayoral offices oftentimes. So Sandy actually helped produce the existence of community preparedness within New York City emergency management, right? Because at the time there was a very rigorous report that said, hey, there's a huge gap between community and faith-based organizations in the city government of New York City. And so likewise, there is like a larger logistical stockpile of response materials to prevent some of the hazards that we saw happen, especially post Sandy. I can't speak to recovery worker protection. I cannot speak to that. But what I can speak is that each agency throughout New York City now has an emergency support function that didn't probably exist some almost 15 years ago or 20 years ago, meaning we all have a duty of, hey, when the emergency happens, pause your blue sky work. You all are now responsible for filling the blank as an agency that's ever present. So I hope that answers your question. I can't speak to the worker protection piece because as emergency management, we don't cover that component.
There is a question in the chat, and maybe we'll take a couple more and get ready to wrap. I think maybe help open up the conversation a bit. What non-traditional partner has surprised you for the most for emergency preparedness, response, and or recovery? Is there a partner you'd never think would be so influential?
It sounds cheesy and I didn't type because all of our partners are really amazing, like very legit amazing. I went to one group in East Bronx, and they're a large Christian church, and they target a Latino population, and they have in the basement, they have this very large space to store the food that they get for the food distribution that happens on Thursday. Well, I go back like 9 months later and I'm like, hey, can I show my colleague your space? And I looked around and I said, wait a minute, something's different. They went back, they purchased a large generator beyond what my eyes could see, and they elevated all the refrigerators, all of the components, the crates that were holding the produce. And I said, wait, you elevated everything. And they said, we've been listening. Like between the work you did with the Food Bank of New York and between Strengthen Communities, we're listening and we know that we have to keep providing food to our populations. We could do the spiritual care, but they need food. They need the bare. So those type of things pleasantly surprise me. And it's not, oh, because it's this partner. It's because they get a hold of like, what is our, like the one thing that we must provide. There was a water scare in Lower East Side, I think about 2.5, 3 years ago. And the community partner, they vested up, they tapped into their network and they begin to get word out of like, hey, don't drink the water in the buildings. This is where you need to go. And then they would organize a community meeting. And, I had some executives saying, hey, tell them not to organize. I'm like, nope, that's what we do not do. We do not tell our partners not to be advocates in their community. They're still our trusted partners. We still can rely on them. We're not going to always please them, but we want them to be as honest with us as possible so I can trickle it up, down, and all around to really find and identify the true solutions for problems. So genuinely, when I say like, there's not a lot of surprise, we work with youth-based organizations and they've done some really phenomenal work. We've worked with some folks out in Southern Brooklyn and they're doing phenomenal work. Staten Island, like all of our partners, they have their own unique touch, and they can't really be compared. One of the stronger partners is East Harlem COAD, and it's because of the history of it, and they're designed for emergency preparedness and response. Whereas the other groups who their primary focus might be individuals with intellectual disabilities, like seeing them shift of like, well, how do I prepare? Like we have this workforce program with people with intellectual disabilities. How can we incorporate emergency preparedness? So seeing their wheels churn and us not being the ones that providing the answer, but being thought partners. That's the best gift that we get to have is being thought partners and gleaning best best practices and sharing it with others. So there really is not like one group that's surprised. Like we really have really great groups.
Angel?
Yeah, I'll co-sign everything. And I also want to highlight that there are also really unique mavens, individuals that are part of these community emergency networks. And I have to shout out our beloved Ms. Carol Johnson, you know, who literally can get into every crack and nook and cranny of the neighborhood because we're such a neighborhood-based organization. She literally seals the cracks of communication or information flow or whatever that is, in the best ways that she knows how, because of her being a native of the neighborhood, born and raised, and the glue she's created. And so we leverage that in many ways, and then those individuals are so critically important, but yet often overlooked.
Adam, have you been pleasantly surprised by any partners in this climate work?
Have I been pleasantly surprised by any partners in the climate work? Well, I think New York City is a leader. I mean, I wrote a book about Sandy, and I think all told, the city was, I mean, we can point to things that went wrong, but I think the city did pretty well, really, compared to other events, like Katrina, for example, which was much worse, for a similar type of event. But and we work with the insurance industry. I think there's been a lot of sort of improvement there in how they think about things in terms of climate change. But I'm basically an academic, so those are my best examples, but I don't have the kind of richness of detail that you guys do for working with so many community partners.
Thanks. In my answer to that, I will attempt to answer that and answer the other lines of questioning in the chat. Um, My pleasant surprise has been, transitioning from clinical work to this public health related work. I think the biggest surprise, I thought that I missed the clinics a bit more because working with community partners from folks, community members, folks working at organizations, but even this kind of bureaucratic community, working with colleagues like Mariah, working with folks at the PRI. This journey, I think, has been really, that's been the surprise that this was even an opportunity, as a physician, trained classically in like Western medicine to kind of transition to public health. Many people have done it, but the line of work that I'm trying to do in this health equity lens, I think is unique. I've just been surprised by, honestly, the willingness for people to sit down for these hard conversations. I think to the question in the chat from Bill and George about preparedness, I'm really, these sorts of activities, from the creation of a pandemic response institute to a preparedness and response, institute, to all of the work that we've been doing at the health department for the past few years, all the infrastructure that was built as it transitions from a non-emergency phase, how we integrate the lessons. Happy to report, following the end of our COVID emergency response, the Center for Health Equity has been really working to adjust our incident command system within the agency. That may not mean a lot to many people, but we've added 2 different response groups so that from the beginning of an emergency or emergency public health activation, we have community engagement groups. We have these networks that we are tapped into, and we have a health equity officer built into the system, which is something that we didn't have before COVID-19, but we really realized that it was something that we needed. The sensitivity to all of the emerging events happening around the world. We know what can happen. We know what is possible in terms of the impact, the global interconnectedness of us all. But I mean, the reality is, public health is facing major threats. Public health is at risk. The funding and continuation of public health to address some of these things beyond a scope that feels like it's always being narrowed. I think the interest in that is down, but I think we have a lot of the skills and the resources and connections to speak to the urgent need for us to be able to have these sorts of conversations, to come be at certain tables that we're not normally invited to, but also to really reprioritize and we think about community safety, we think about community preparedness. How do we understand that is all deeply connected to our communities themselves and these social determinants? I don't know how you can, respond to the catastrophic event. I think you can only do so much to prepare for the catastrophes, right? But for the things that we know do come, we know that the climate is changing. We know that this world is more interconnected, right? We know that what can happen if a highly contagious respiratory virus that passes from person to person is introduced into a community, into a society. We know what that looks like, and I think we're smart. A lot of us doing this work, we feel smarter because of it, but we also have so many more tools, access to tools, and a level of understanding that I think definitely counts for something. Um, and I think as we kind of are adjusting to the new realities that we face, really just think about the reality of our moment, and what we can do and to who we see as first responders and how we can, see that as a part of all of our work versus, a cavalry, coming in. Because I think that's what we're being called to, and just really grateful for this conversations. We have a few other questions, comments in the chat, but just wanted to, as we get ready to wrap, um, bring Mitch in as we get ready to close, and then we can kind of do final remarks from the panel.
Yeah, thanks. Dude, I love these conversations. In all candor, I think we have enough time to dig into it. There's so many questions. This is like real, it's almost like citywide planning that we're doing here. And so I guess I want to lay out a couple of next steps. We talked about Julian and close with a challenge a little bit. There are two more of these that are coming up. The next one is on communication. Right now we're wrestling so much with this question of misinformation and rumors and inaccuracy and that's going to be the next focus. And then the final event is going to be centered around a call to action. And look, let's take this seriously. I think stay ready so you don't have to get ready if Carol is willing, because I don't want to violate your copyright, Carol. That is definitely not what I want to do. But let's just call it what it is and put that out there and talk about it. And I guess I want to hear in this, we've talked a lot about hyperlocal organizing, right? And the importance of it. So I do want to give the panelists a challenge. And I mean, Julian, do with this what you will, and let's see how we close. Strengthening communities is so great. The predictive work that Adam is doing is so important. East Harlem is like an exemplar of what's possible. But we know that strengthening communities can't fund every neighborhood, right? East Harlem is there are other strong COADs in this city, but there are hundreds of neighborhoods that haven't gotten that far yet. And a lot of times the modeling and the science that we do doesn't get to decision makers, or they don't use it for their long-term planning. We do need to get from here to a strong network where everybody is holding hands together and thinking their best thoughts. And I guess as we have two more of these conversations, let me put it to you, Julian, and see what you want. How do we get from here, which is great and so much good work has been done, to up here where these communities are standing together, but also listening to the science and learning, and decision makers are making the right calls for this stuff.
Thanks, Mitch. The way I think about it, these sorts of things have been done before. So the great thing is that we're not starting from scratch. So if it feels like that, we can remind ourselves that we're not. People have been organizing themselves across from different organizations, institutions, etc., to respond to urgent needs for a long time. So once again, here we are. We did it. We started it 5 years ago. We had some bumps, but here we are now. And I think we're at a time where we can kind of think about it on a more broadly. We're thinking, public health emergencies also include these climate emergencies. We've already done that groundwork. So it's truly thinking about what is that process that we want to make to what are the convening spaces? What are the regular meeting spaces that we can commit to? What infrastructure do we have? What assets are in the room on the call that we can kind of put on the table, or what we can commit to as a process moving forward? That's what we've been thinking about in our public health core work in the city, and thinking about ways like, what is our monthly meeting? What are the public health updates? What are the things that we need to prepare for? Thinking about seasonal programming, right? We know how the seasons work. What are those climate risks season by season that we all should be thinking about preparing for in the public health realm? In that public health mindset, how do we tap into all of the models and predictor models and all of all of that science that can help make us have a stronger case, or kind of make the case kind of more clear for folks? I think that's where we are. And again, like those practical solutions, like there's all the high up in the sky things that we all do in our respective places, but we also can't forget like this is the everyday, the older adult sitting in front of the box fan, in a hot New York apartment in East Harlem. We got to think about those folks too. So yeah, I would love for us as we shift as we kind of move to the second half of this, that this is the beginning, this is a process that we're engaged in, but I think this action and this next steps and us kind of coalition building, I think that's where it's at, and that's where I would really love to take this series and kind of move towards.
Love it. Love it. And I'll just say for those participants, some of y'all have done this a couple times with us now. info@pri.nyc, info@pri.nyc. If you want to say, y'all, you need to cover this. I want to cover how I deal with misinformation. I want to cover how I bring in other neighborhoods. I want to cover funding my community. Hit us up and we will adjust agendas accordingly because we really value these deep conversations. And I want to thank Bashar Mackay, who did so much work behind the scenes, pulling this together. Thank you so much to Adam, to Mariah, to Julian, to Angel for this conversation. This is how New York stands together. There's a lot of chaos in the world right now, and the city needs to have the city's back. And this is an example of that happening. And I'm grateful and full of sort of love and affection for everybody here for doing that. So thanks so much.
Well, thank you
and
so
have
much.
a good afternoon, everybody.
Thank you.
Thank you. Honored to be a part of it.
Thank you all. Take care.